We can't hear Faye.
Up the volume.
Okay, no one's able to hear Faye.
Can you hear me
No.
now? You hear me? Okay. I'm wondering, Lisa.
Okay, and I see several of you are asking to turn the volume up, which we are working on our end.
This is Joe.
Can you hear me now?
Can you just nod your heads if you can hear? Okay, most people can hear. I am recording this, so that means we will be able to still send you the link. So if there's anything that you've missed, we will ensure that you've got the recording to listen to.
Yes, thank you. So let's go ahead and start with the fat-soluble vitamins. I'm going to cover 4 vitamins: vitamin A, vitamin D, E, and K. Those are the fat-soluble vitamins. That means that they can only dissolve in fat. And therefore, if you have a deficiency, let's say, conscious of the fact that you cannot, if you are not a healthy person, you cannot have manufacture enough of these vitamins in your body. So you need to either supplement them, or you have to have a diet that basically gives you all of these necessary vitamins at the right dosage, so that you can replenish your reserves. Vitamin A is basically a vitamin which acts as an antioxidant, and that means it's an anti-inflammatory vitamin. As you know, the hallmark of Parkinson's disease is the internal immune system inflammation and digestive system inflammation that causes ultimately the brain inflammation, which comes with all of the symptoms that we recognize and associate with Parkinson's, such as memory, poor memory, tingling of the hands and feet, fatigue is a big one, depression, pain, especially muscle pain. All of those are, a part of the symptomology of Parkinson, and that could be related to A vitamin deficiency. And now, where do we find that vitamin A in our diet? If you were like me, you don't want 10 different pills thrown at you every hour of the day. I recommend that you look into the dietary sources of this vitamin A, so that you can benefit. First of all, you eliminate the deficiency that you may have, and second of all, you get the benefit of enough of that vitamin in your system. The sources, the best sources of vitamin A are liver, especially beef liver, but chicken liver would be fine too, or turkey liver. Yolk, basically egg yolk, fish, you can choose salmon, trout, cod. You can also have butter. Yes, just a regular organic butter would replenish your vitamin A reserves. Now, how much is enough? basically, 900 microgram of vitamin A is enough for an adult who's over 70. And when you go below 70, let's say between 50 and 70, you need 800 microgram of A. And how much is that? What does that mean in real life? Basically, that is a very small amount of A vitamin that is found in an average multivitamin. So if you take an average but high quality multivitamin, such as Nature's Made, that everyone has access to, or Now Vitamin, NOW, and you look at the label, you will see anywhere between 800 to 1,000 microgram of vitamin A in that particular multivitamin. And that is a completely enough amount. So you don't need to overdo it. Let's stick with the quality multivitamin or vitamin A. Vitamin D is a different type of vitamin. It basically is found in liver, also in egg yolk, tuna fish, salmon, sardines, anchovies. So vitamin D is a very important vitamin because it can convert in our body, it can convert calcium into an absorbable form of calcium. So we need to, in order to absorb our calcium, we need to have enough vitamin D in our system. The right amount of vitamin D intake is about 1,000 a day, 1,000 IU, or international unit, which is the measurement unit for vitamin D in one day. And that is a good amount to start at. Some people who do not walk outside between the hours of 10 a.m. and 3 p.m. in sunny conditions, or they basically don't get, their mobility is so low that they don't get to go outside much at all, whether it's summer, fall, winter, or uh, summer, fall, winter,
Spring.
and sorry, I'm having a moment.
That's okay.
And spring, that those people definitely need to up the dosage of their vitamin D to about 5,000 IU a day. Now, the 5,000 is not a number for everyone to follow, because if you have too much of vitamin D, it is not too much. By that I mean, if you have a couple of thousand extra vitamin D, although it's not going to cause any toxicity, it is still not recommended, because you're going to have a little extra of this vitamin D, which is an oil, in your liver stored away, and that is going to make your liver basically less apt to detox, which is one of the main jobs of your liver. So why waste it when you don't need it? How do you decide how much is enough for you? Is it 1,000? Is it 2,000? Or is it 8,000? Well, typically, again, that is decided by your age, your mobility. If you do get the sunlight basically on your skin, in order to produce the then you're between the hours of 10 a.m. and 3 p.m., then you are not going to need to have more than 1,000 IU. All right, let's move on and talk about E vitamin. That is an antioxidant vitamin and anti-inflammatory and anti-cancer producing. It is a wonderful fat-soluble vitamin. It's found in nuts and seeds, especially in walnuts and almonds and seeds. Some fruits, such as kiwi, have vitamin E. Avocados, red bell pepper, vegetables. So veggies could include the red bell pepper that we talked about, avocado. You can also find it in eggs, and you can find them in butter and in salmon fish. The job of vitamin E is basically to keep the inflammation down at the minimum. So I would like for you guys to pay attention to getting this vitamin along with the others, AD, that we talked about earlier. Keeping the balance of these vitamins at just the right level so that you're not going to experience a deficiency and you don't need, therefore, to add that vitamin along with the D and the A as a supplement to your diet. My point about getting your necessary extra vitamins in the form of a food rather than pills is due to the fact that when especially people with Parkinson's who start going up in age after age 50 especially, they are going to experience, most of them experience digestive issue. So, such as lack of absorption, lack of the lack of acid causes slowing of the mobility, and that alone causes constipation, which is a problem, as you all know, among the majority of our population. About 90% of us with Parkinson's suffer from chronic constipation at one point or another in their lifetime. So as you see, everything is related to everything. So if you can try, and you have to eat food anyway, you might as well eat the foods that are compacted and basically containing a good dosage of antioxidant, anti-inflammatory, and also the property that allows the food to move through your digestive tract faster. That condition goes basically to fight gastroparesis. Gastroparesis is a sluggish transit time of food due to lack of stomach acid. And basically, I recommend that everyone after the age of 50 take a digestive enzyme that contains a touch of acid. This is stomach acid. And those are, I recommend the ones from Designs for Health, as well as some great quality digestive enzymes from Claire Lab Claire is spelled with a K, K-L-A-I-R-E, laboratory, and they make a high-quality digestive enzyme that contains a touch of betaine, B-E-T-A-I-N-E, betaine hydrochloride. And basically, that taken about a half hour to an hour after your meal is completed, it will allow you to absorb the majority of your nutrients out of the meal that you just had. And that is my recommendation. The last fat-soluble vitamin is K, which helps blood clotting. And that consists of two forms of K, is K1 and K2. You need to be very careful not to take K vitamins if you are on a blood thinner, such as warfarin or Coumadin. Yes. Did you have a question, Lisa?
No, you're doing great.
Okay, thank you. So I basically recommend that you talk and consult with your doctor about whether or not vitamin K is indicated for you. I like it a lot because, especially when it comes with vitamin D in the same bottle, they help K2, especially K2, helps the absorption of it helps the absorption of your calcium and your D vitamin. And I, for instance, like the product from Pure Encapsulation. Pure Encapsulation makes a very good high quality vitamin D3, as in number 3. And it comes with just the right amount, or 100 microgram of K2, which helps the absorption of the vitamin D. But just be careful about the blood thinning factor, because this has a blood clotting agent in it. Vitamin K does. And if you are taking that with a Coumadin or a blood thinner, you could literally bleed to death. So we don't want to take that lightly. All right. By the way, a good dietary source of vitamin K2 is fermented soy or green leafy vegetables, such as kale or spinach, or you can have frizzy lettuce that is dark green. Those are some examples of dietary source of K. All right. Moving right along, let's talk about the B vitamins now, as it applies to all of us, people with Parkinson's. B vitamins are water soluble, and they also need to be taken very carefully because they can interfere with some drugs that you may be advised to take. For instance, vitamin B12 is one essential vitamin that most of us, if not all of us, on the with the Parkinson's diagnosis need to have. Why? The reason is when you are above 50, due to lower stomach acid production, which is needed, the very acid that is needed for absorption, decreases in quantity as we age. And therefore, most of us, if we're not careful and don't compensate by adding some dietary sources of B12 to our meal plan, we will suffer from the heavy-duty list of symptoms associated with B12 deficiency, such as fatigue, depression, poor wound healing, very poor wound healing, and then thinning of hair. Lack of energy or fatigue is the worst symptom, in my opinion, of vitamin B12. So the good news is these days, in order to determine how much is enough, we can measure that with a very easy serum blood test. The serum blood test, you can walk into a laboratory and literally say, I need to test my B12, and I need to do it through a blood test. Most laboratories, because it's a very inexpensive test, they can run that test for you without a doctor's order. But some of them are a little bit more stringent with the rules, and they request a doctor's order. So once you get the results back, if your vitamin B12 level is below 200, you definitely are deficient. And if it is above 500, you are not deficient, but you are on a borderline. So my recommendations are, at the minimum, start with a 250 microgram of vitamin B12 a day, if not 1,000 microgram of it. So I do recommend that most everybody who has the diagnosis of Parkinson's or celiac disease, by the way, which is somewhat related to Parkinson's by way of the digestion being affected, I recommend that those people take a minimum of 1,000 microgram of B12. And by the way, you might ask, well, Faye, isn't there a danger of overdosing on vitamin B12? And the answer is really no. Not unless you take a horrendously high amount every day for three to 4 months consecutive. And by extremely high amount, I mean things like 10,000 microgram of B12. And otherwise, we do, because it's a water-soluble vitamin, we do dispose of the excess amount in our urine. So you again don't have to worry about having a toxicity of vitamin B12. But the deficiency of it is much worse, because it can cause, again, tingling of the hands and feet, memory issues, extreme fatigue, and so on and so forth. And all of these could be related to the malabsorption that occurs in the stomach area. All right. B9 or folate is another vitamin B that we need to get in addition to what we eat, basically, because it is almost impossible to get all of the folate necessary for us to maintain health by just having a dietary source. It is an essential B vitamin that we do not make, but we need. And it is found in green leafy vegetables, such as spinach and kale and lettuce. However, what you need is, if you want to just get all of your needs met through the diet, it's almost impossible because you're going to need 9 pounds of spinach. 9 pounds. I don't know about you, but I'm going to be so constipated if I have 9 pounds of spinach. It would take a horrendous amount of laxative for me to get over. So I do recommend that you take a folate supplement. By the way, folate from folic acid or from folinic acid are not absorbed properly into the brain. They, in fact, will not cross the brain-blood barrier. They just won't because they are made of a synthetic source of folate. The only form of B9 or folate that is absorbed by the brain is L as in lion, L-metyl tetrahydrofolate, or for short, they're called L-active folate. Active folate is the good form, the absorbable form, and the only form of B9 or folate that can cross the brain-blood barrier. So knowing that, I would recommend that you have among the B vitamins, you must add as a supplement the B12. Of course, it's best if you can determine by that serum blood test what your current level are so that you can choose the right amount of B12. Yes. Did anybody have a question?
Okay, hold on. Looks like Ned has a question. Ned, can you unmute?
Yeah, I just did, I think.
You did.
Um, yeah, Faye, that's a lot of information you gave us, a lot of important information. In fact, I'm a little overwhelmed. I wish we had an outline so I could somehow elaborate on all your points.
Yes. Maybe I could prepare an outline and send it to Dabs, Felicia. What do you think?
Absolutely. I think that's a great idea.
That'd be, for me personally, that'd be wonderful.
Yes. Yes, that is fine, Ned. I appreciate your input as always. I can produce.
Your information is so important, Faye, but it's a little overwhelming, so I need an outline to follow it and make sure I do it and then put some discipline in it.
Absolutely. That makes a lot of sense. Absolutely, Ned. I'll be happy to. Within the next couple of weeks, I can send something to you, Lisha, and maybe we could put it in the next newsletter or some way of maybe.
Or just have a handout at your, just have a handout at the DABS meetings.
Oh, yeah.
Sure, we can make sure that's distributed to all of you, both digitally, and we can also make a copy of that as
supplements are not highly talked about with doctors. And it's an underappreciated need that we have as we get older, and particularly with Parkinson's. And I think Faye brings a lot to light that I wish our physicians would talk more about, even our neurologist. I have a great neurologist, but she's never talked about supplements. And I think that's just terrible. And Faye, thank you for enlightening us, but I think we have to really carry this message forward.
Good
That's
point.
all.
Good point. I've got another question here, Faye. I'm going to unmute Joyce. She's got a question. Joyce, can you unmute?
Here we go. First of all, I agree with the last gentleman. I had no idea. But I have two questions. Do blood tests help you know what your vitamin intake and what it should be and not be?
That's a great question, Joyce. Yes, yes and no. Not all vitamins are, not all of them basically that I've discussed today are available readily at the doctor's office to measure your deficiencies, if that's what you're meaning. However, there are certain vitamins that are becoming more mainstream, such as vitamin D, the sunshine vitamin. As you know, most all of us, when we show up for an annual physical at the doctor's office at our PCP, they do include a vitamin D. They don't even ask us. And I'm very grateful. But it has taken about 2 decades for people to finally, for the professionals, to finally accept the validity of the vitamin usage in our health plan. Because without, for instance, B12 is one of the most robustly associated with Parkinson's symptoms. I personally, how I found out that I had Parkinson's was through a blood test that measured my B12 deficiency. And I was extremely deficient, not just a little bit, but extreme, because in addition to Parkinson's, I was a vegetarian for about 15 years. And unfortunately, I was not supplementing sufficiently with the vitamins that are typically low among vegetarians. Vitamin B12 is found in dairy, eggs, beef, and basically beef liver. And 3 out of the 4 basically food that I mentioned are not eaten by vegetarians. They don't have beef, therefore they won't have the beef or the beef liver. They don't have eggs, and but they do have dairy. Some of them have dairy, some of them who are vegan don't. So as you see, if you are a vegetarian, that automatically puts you in the category of highly deficient individuals in B12. And that predisposes you to developing acute Parkinsonism, which is a form of Parkinson's that basically has all of the symptoms of classical Parkinson's. All of that because of a deficiency of a B12. Isn't that the silliest thing you have heard? And something that could easily be reversed. It being ignored by most PCPs because of lack of knowledge. Knowledge is power. And I hope through these classes that we're having through Zoom, that we reach our whole entire community of people with Parkinson's so that they are the carrier of the good scientific message to their doctors. I know it should be the other way around, but doctors sometimes don't have time. They're given 14 to 15 minutes per patient. So I don't fault them. They are going to make sure that your prescription drug needs are met first before they start talking about vitamins. And the lack of knowledge among the population of professional doctors, that also drives the fact that they don't order a test. So the burden of responsibility is on us to take that message to the doctors and say, what do you think, Doc, about me testing for B12 and for even B9, that folate that I was talking about?
And Faye, I'm sorry, go ahead.
No, once we know that, then we can target it correctly and recommend the right amount of supplement.
Thank you. Sharon has a question about B9 or folate. How much is recommended as a supplement? And just to follow up on that, is it different for men or women? Is it kind of standard? Does that change if you have Parkinson's or don't? Can you expand a little bit on that?
Sure. Folate, I do recommend that an average person with Parkinson take about 1,000 micrograms. Simply because we again don't get enough of it, and if we do get it through a supplement, we need to be sure that we get the right, most absorbable form of it, which is folate, not folic acid, and not folinic acid. And a lot of the products out there contain this folate in a synthetic form, which is the folinic and folic acid. And unfortunately, we don't get any benefit from them. So make sure you get it from the appropriate form of folate, which is the active folate or B9, and without a trace of folic acid or folinic acid. And you take about 900 to 1,000 micrograms a day.
Got it. Thank you, Faye. That's helpful. Joyce has got another question here, so I'm going to have her unmute so that she can.
What kinds of, you were telling us about lettuces, the green and stuff. Could you tell us some more vegetables and especially fruits that you would recommend? You didn't say anything about fruits, so I'd be interested in the fruits.
Yes. Are you talking about in general what I recommend in terms of fruits and veggies, or specifically for satisfying a certain vitamin deficiency?
Joyce, Joyce, you're muted.
Does it mean that we eat more apples than bananas, or, what are some of the good fruits that we should be eating? Grapefruit or?
Okay, that's a good question, dear. In general, I recommend having 2 servings of fruit a day. That means 1 medium organic apple. That constitutes 2 servings of fruit, because basically a half a medium-sized apple is the equivalent of 1 serving. So that's that. You can have kiwi. I like the size of 1 kiwi basically to be counted as 1 serving of fruit. And it is rich in vitamin C and in vitamin D. And it's tasty and it's just the right acidity. So it will allow you to break down more of your prescription drugs. Because of the acidity in the fruit, you will absorb your Rytari or your Cinemet or whatever dopamine agonist that you are on. It allows you to absorb your drug better, because your drug that we take for management of Parkinson symptoms are very acidic. And acid dissolves in acid. So we need to have some sour lemon juice, just a splash of it, for an example, with our medication for Parkinson, the L-Dopa, so we can absorb the medication better. So those are good fruits. The halo, little cutie oranges are very good. You can have 2 of those, counting for 2 fruits. I do also recommend plums, especially in this season. Basically, plums are a good laxative, natural laxative, but it varies. The dosage or the amount that I recommend depends on the degree of your constipation and the desired laxation that you want to get by adding these fruits. And what works for me like a charm is 3 small plums. They happen to do the trick for me as far as constipation goes. So I keep constipation at bay. So those are the fruits that I basically recommend. Not that you can, papaya. How could I have forgotten? Papaya has a natural laxative in it. It is a wonderful fruit because it is abundant in vitamin C and high in fiber, and therefore, and very tasty. So it is a very useful fruit. Any other?
I'm going to go. Yes, I have one more
Yes.
because I just want to absorb as much information as I can. So
Yes.
before you mentioned something about Bell's something Bollock or something, could you explain, is it Bell's? What is it? Bell's middle name and end name, and what does that do?
We talked about
Faye, I recall you talking about red bell peppers.
yes. Yes, we talked about that. It was in the context of antioxidation.
Mm-hmm.
But in general, yes, you can use any fruit and any vegetable, basically, except for spinach. Among the veggies, has a tendency, because it is rich in iron, it has a tendency to constipate people, so we don't want to have too much spinach. And also, kale has a tendency to do that if you take it, especially close to your medication. You need to space those out by about at least an hour from your meal and from your medication time. So, and of course, I do recommend that you stay away from bananas. Bananas have a laxating type of property. I'm sorry, the reverse, they're constipative. So you need to compensate by having papaya or kiwis or plums. Yeah, general red bell. Yeah, red bell is the veggie that has high fiber. Yes, ma'am.
Joyce, do you have another question?
Yes, and this should be my last one. I'm sorry, but I take Arteri. You have to take it. If I take it at 7, I have to stop eating at 11, take it at 12, and then stop eating at 1. Now, how do I find out which of these vitamins work with that medication or do not?
Work with the medication or not, meaning if it interferes with the absorption?
Yeah, I mean, if I take Arteri 4 times a day, every 4 hours, what should I stay away from, or what should I do more of? Because I don't think the doctors would be able to tell you that.
Yeah. Basically, if you're having Rytari or your L-Dopa 4 times a day, that means that you have a good 3 hours between each medication dosage. So what I would do is I would wait about an hour after the medication is taken, and then go ahead and have any of the fruits and vegetables that we discussed.
Okay, because I just don't know if a lot of doctors, know the difference and, have been have studied this. Would like a compound pharmacist know more about interactions with, you know, Parkinson's and other medications that you take?
You can try, dear. You can try. Sometimes my pharmacists know the answer. Sometimes they don't because they are also so overwhelmed by all the different findings that have hit the literature that I study day in and day out. Sometimes you can find pharmacists to give you an answer, but typically, if you wait about an hour, in my case, because I am usually hungry right away after I take my medication, my Cinnamate or my Rytori or what have you, the L-Dopa, I'm ready to devour my food. So I usually walk around the house and feed my pet and set the table up and wash my hands and feed again anybody else who is around me at the house. And then I get my meal put together. And that right there allows me half an hour
Yeah.
to prepare. Yeah. I
So,
think after your medication time, you are safe to take anything that you like. But I want to use this caution. I don't recommend beef to any Parkinsonian because beef interferes. The amino acid in beef is so concentrated that even if you were to wait 4 hours between your medication time and eating a bite of beef, you still will not be able to avoid having a big interference between beef and your medication efficacy. So I personally have eliminated all sources of beef, and I have seen a net increase in my clarity of mind, in my reaction. So instead of having the bradykinesia, the slowness of reaction time, and so on and so forth, I have seen a very noticeable benefit from eliminating beef.
so Faye, I'm sorry, I'm kind of cutting you off here since we're a little after 3. I just want to make sure that we're covering any other questions around supplements and vitamins. And Jan is going to need to hop off, but just wanted to come back and say, was there any other information on vitamin Bs in general that you would want to leave us with? And again, just as a reminder to everyone, we are recording this session and we will absolutely make sure that all of you have that link in addition to the outline that Faye has offered to provide us with. So we'll definitely make sure if there's anything that Faye's not able to cover in our last couple of minutes, we'll make sure that we get that information to you. But I just wanted to pass that on to you, Faye, if there was anything you wanted to finish up with around vitamin B.
In general, vitamin.
Correct.
Okay. I basically recommend a B complex for most people with Parkinson's because that would include the B2, B6, B5 or pantothenic acid, B9 or folate, and B12. Those are the most crucial vitamin Bs that are water soluble, and they don't present a risk of toxicity. Even if you were to go higher on the dosage, I would recommend that you consult with a professional nutritionist or a dietitian who is trained and specialized in the area of Parkinson's diet, and let them be the judge of how much of the B complex you need, if any, because some of you may have enough, let's say, rice with vitamin B9 or vitamin B6, which are cofactors of in multitude of biomedical type of reactions that occur in the body. Those vitamin Bs that I listed in the B complex are very beneficial for Parkinson's patients. So I hope that you got something out of this session and you will walk away more basically knowledgeable about the need for some of these vitamins in order to keep to mitigate some of the symptoms of Parkinson.
Can
Absolutely.
we email you?
Really, really helpful. And I would certainly encourage all of you to follow our newsletter. Has got a lot of upcoming educational series. And the reason I bring that up is because oftentimes the reps are extremely knowledgeable when it comes to a particular medication, like, for example, whether it's Rytari or even one of the newer treatments that are available. And sometimes they're able to give you a little bit more information about really what might help just to make your medication a little bit more effective. So just in terms of advocating for yourself and any tweaks that you might be looking into, those are really good folks to inquire with and tap their brain for a little bit more information about a particular treatment.
Can we
All right.
contact you directly somehow?
Faye, are you comfortable if I provide your email?
Yes, that is fine. That is fine.
Okay, perfect. I know, Faye, you've got another appointment, and I am so thankful that you stayed on with us longer than you had originally planned. And thank you and each of you for your patience as we sometimes battle technical issues and Zoom issues. So thanks to each of you for your patience, your flexibility, and especially thank you to Faye for the wonderful information and knowledge that you share with us every quarter.
Well, thank you so much. I'm so glad that I took the time to be on this call because you don't hear about the nutrition part or the vitamin part. Nobody tells you that you need to do all this stuff. One quick question, what other meats should we stay away from?
And I tell you what, Joyce, that is an excellent question, and that is actually we've actually got one of Faye's previous recordings that talked a lot about those proteins, and she goes into some great detail about meat. So I tell you what, Faye, I will go back on our YouTube channel, and when I send everyone today's link, I will also include that link if anyone is interested in hearing her talk more, because it's pretty fascinating, and she's got some good personal anecdotes that she shares in that as well.
Thank you, Joyce. Thank you, Lisa. I appreciate it.
Of course, of course. Thank you all again so much. As I mentioned, I'm going to send you the link. I will send you Faye's email address. I will also include the outline and, of course, the link to the previous Ask the Nutritionist program on meat and protein. So be looking for that over the next few days, probably mid next week. Until then, thank you all for joining us, and I hope you have a wonderful weekend.
What about October 4th?
October 4th is our annual symposium, and so it is an all-day affair. It begins at about 8:30 on a Saturday morning. It goes till about 2 or 2:30. We bring in experts all around us, from movement disorder specialists to physical therapists. This year we have secured a music therapist who has some really interesting research when it comes to the benefits of music and neurological conditions. We've also got a pharmacist that will be a part of our panel. So each year we bring in different specialists just to help you have more information and feel a little bit more equipped to live well and
Where will it be?
It will be at Lovers Lane United Methodist Church. It's it's North Dallas, Toll Road, Lovers Lane area.
Perfect. Thank you so much again.
Absolutely, you're welcome. It was so great to see so many returning faces and new faces as well.
What is your name quickly? Because I missed that part.
Sure. My name's Leisha Phipps. I'm the executive director for DAPS. And so we host these programs once a quarter. So our next one will be in October.
Thank you again.
Okay, you're welcome. Take care.
Bye.
Bye-bye.